Good morning. My name is Dr. Neil Kalman, and I'm President and CEO and a co-founder of the Institute for Family Health. The Institute provides comprehensive primary care services, behavioral health services, and oral health services, as well as supportive services for over 100,000 patients in New York City and the lower Hudson Valley of New York State. It's my pleasure to welcome you to our second congressional briefing that the Institute for Family Health has done to facilitate a dialogue between our staff and leadership and the congressional representatives who represent the areas we serve and who support the work that we do through their legislative efforts. I also want to thank the congressional staffers who are with us today for taking the time to always learn about our issues in detail and for the valuable work you do on behalf of federally qualified health centers and teaching health centers and the patients and trainees they serve. During this session, you're going to be hearing about a few select features of our work at the Institute for Family Health. You'll hear about our decades-long struggle to end racial disparities in health outcomes, our efforts in training the next generation of physicians, nurse practitioners, and nurses to work in urban and rural underserved communities, and some of the groundbreaking work we're doing on addressing the social and economic causes of poverty and poor health. There's much more that we could love to share with you if we had all day. The work we're doing in opioid addiction, our homeless healthcare network, our school-based health center network, our nationally recognized women's health program, and the work we've done for decades on HIV/AIDS, our substantial health services research programs, and our efforts in LGBTQ health, among others. We hope to cover some of that in future programs, and you can find information on all of those programs on our website, www.institute.org. I want to thank our congressional representatives who made themselves available to us as we shared our concerns and needs, not only through the COVID-19 pandemic, but for the decades that we've been doing this work. And I want to acknowledge our incredible staff of over 1,300 dedicated healthcare workers who struggled for the past 2 years to deliver world-class healthcare services in the face of personal risk and the losses that they themselves may have had among their family and friends. It's now my privilege to introduce a recording made by Congresswoman Nadia Velasquez, who serves the 7th Congressional District of New York, a diverse district that includes part of Brooklyn, Queens, and Manhattan's Lower East Side. As the first Latina elected to Congress and the first to chair a full congressional committee, she has long championed healthcare as a right for working people and the poor in her district, the state, and in the nation.
Good morning. It is great to join you all virtually today. I would like to start by thanking Dr. Neil Kalman and all the hardworking staff at the Institute for Family Health for the incredible work they do to ensure high-quality, affordable health care is available for all patients, regardless of their ability to pay. With facilities operating across New York City, including one in my district, the Institute for Family Health provides essential health services at a time when access to health care could not be more critical. Last year, New York City was the epicenter of the coronavirus crisis. Many families delayed or completely put off annual medical checkups or procedures during this time out of fear of the virus. At the same time, health centers were inundated with patients sick with the virus or dealing with other illnesses. Now, we are witnessing vaccination rates across the country rise, allowing us to begin the climb out of the worst days of this pandemic. This is a pivotal moment and calls for our country to invest big in healthcare. A substantial investment in healthcare means addressing the persistent racial disparities in our system, which were exacerbated during the pandemic. In New York City, the disparities and inequalities in access to healthcare were front and center, with Black and Latinos people being twice as likely to die from coronavirus than white people. Last year, Latinos made up about 29% of the city's population, but nearly 34% of the people died from the virus. These statistics are completely unacceptable, which is why the first bill I introduced in the 117th Congress was the COVID-19 Prevention and Awareness Act. The bill allocates $2.12 billion in grants to help community health centers prevent and address the pandemic for New Yorkers who have underlying health conditions and are more vulnerable to the coronavirus. Specifically, the bill will support community-based nonprofits and federally qualified health centers by allowing them to increase their efforts in treating individuals, which includes frontline and service industry workers that are predominantly people of color. Along with my bill, the Build Back Better Act, currently under consideration in Congress, will deliver the most significant expansion of affordable health care in a decade. And I will never stop fighting for affordable health care for all New Yorkers. Again, thank you so much for inviting me today. Please know that my office is always here as a resource. Thank you. God bless.
And thanks to Representative Velasquez for such a great message. Very inspiring. I want to introduce Dr. Eric Gale. Dr. Gale is a graduate of the Mount Sinai School of Medicine and began his career in family medicine at the Institute's Beth Israel Residency in Urban Family Practice in 1995. Dr. Gale joined the Institute as a staff physician in 1998, currently serves as our Vice President for Medical Affairs and Medical Director of all the Institute sites. He also mentors students of color who are interested in careers in medicine and leads the Institute's credentialing committee. Dr. Gale is going to discuss the work of our Institute in eliminating health disparities and achieving equity in health outcomes. Thank you, Eric.
Thank you, Neil. Good morning and welcome to our representatives. Congressional representatives, it is our honor to share our alignment with you to impact and address inequity in healthcare and how we at the Institute continue to live up to that commitment, which is embedded in our mission statement. We do so through advocacy for our patients and the communities we serve, and through the care provided to all who are welcomed through our doors. Alongside primary care within the family medicine model of care, we provide services across this great state, inclusive of our rural health network in Ellenville, Healthy Families programs in Ulster and Dutchess County, to school-based health centers, homeless centers, WIC programs in New York City. Our Bronx Health Reach program, for which we are thankful for Representative Richie Torres' support, partners with community-based organizations to improve the health outcomes of the Bronx and have been recognized for its work as a community-driven program focused on social determinants such as education, nutrition, fitness, and self-management, coupled with access to healthy foods and safe places to exercise. While the COVID-19 pandemic further highlighted the vulnerabilities of people with chronic diseases and those of color with disproportionate impact on their health, the Institute is open and accessible to our patients in all our communities, providing both in-person services and telehealth services, providing both acute care for the sick and care for chronic health problems. Throughout the pandemic, in our under-resourced communities, we have encouraged and provided testing for COVID-19 virus, and today remain a part of the public health effort, including running a mass vaccination site and vaccinating more than 30,000 patients with COVID-19 vaccines. Additionally, we would like to share with you our organization's accomplishment of having eliminated the racial gap in health outcomes for our patients with diabetes. We began this effort more than 10 years ago, and currently our Black and Hispanic patients are achieving the same clinical outcomes as our white patients. We see this accomplishment as a testament to our commitment to eliminate inequity in health outcomes. With your support and advocacy, We are certain we will be able to do even more, as there remains much work to be done in that space. In sum, the Institute is committed to playing a significant part in improving the health of the communities we both serve in striving for equity in health outcomes. We are committed to participate in the public health effort to reduce the impact of the COVID-19 virus on our communities through education, testing, and vaccinations. We are grateful for all you are doing to advance equity in our communities and look forward to being a partner in these efforts. Thank you.
Thanks so much, Eric. Wow. Last week, I had the pleasure of interviewing Congressman Richie Torres, who wanted to make sure that he participated in this event, but he knew he couldn't make it to be on live today. Representative Torres has been a staunch supporter of the Institute's Bronx Health Reach program, a program which was designed to eliminate disparities in health outcomes for diabetes and heart disease in 4 zip codes in the Bronx, and now throughout the whole Bronx. That program has been continuously funded by the Centers for Disease Control since 1999. Representative Torres represents the 15th District of New York. He spent his political life working for the poor and working class citizens of his native South Bronx and other similar areas of New York City. He's a seasoned fighter for affordable housing and healthcare. Representative Torres was the youngest and first openly LGBTQ member elected to the New York City Council. Here he fought for federal regulatory housing protections and increases in public housing investments. He continues this work as a member of the U.S. House Committee on Financial Services. Hi, Congressman, thank you for joining us. It's really a pleasure to see you, and we're very grateful that you were able to be with us today.
It's a pleasure to be here, and thank you for being so accommodating.
Yeah, no, there's a lot of important things happening in healthcare these days, so we know what your priorities are. So we just wanted to maybe take 5 or 7 minutes to just talk to you a little bit about what you see as the major objectives in terms of the work that you're doing in Congress related to healthcare, and especially as they relate to the work that we're doing in the Bronx. You know, you've been a champion for working with the underserved population with us. You've worked with our Bronx Health Reach program before. You're pretty familiar with the work that we're doing. What do you see as the priorities right now in terms of the things that we need to do in Congress that will help communities like the ones that we serve?
Well, I've been on a mission to break the cycle of racially concentrated poverty. And for me, poverty is not simply about the income in your pockets. It's about the quality of the environment in which you live. It's about social determinants of health. And that came painfully to light during COVID-19. The South Bronx, which has among the highest rates of diabetes and obesity and hypertension, had among the highest rates of COVID-19 morbidity and mortality. And we know that the most common COVID-19 comorbidities were cardiovascular diseases. I think early on during the experience of COVID-19, there was a myth that COVID is the great equalizer. And even though it affects all of us, it affects us unevenly. And it has a disproportionately more destructive and deadlier impact on places like the South Bronx, which have less access to fresh food, less access to amenities in general.
Yeah, we, as you know, the Institute's been doing enormous amount of work in distributing vaccines, and it's been sort of astounding how many people have lined up to be vaccinated and how different the access to those vaccines and to testing was even in the beginning, right, for people. And so, there are many things that have contributed to the unequal distribution of the horrors of COVID-19 across different populations. So one of the things that we're experiencing a lot now is an issue related to the healthcare workforce. As you may have heard, there's mass resignations in people in healthcare after the turmoil that they experienced. People being out of work, but also people being exposed to COVID and working in, really in environments that were just nobody could have imagined when they took jobs in healthcare. So we're working to expand the teaching programs that we're doing, and also to develop some, real work career ladders for people in healthcare to try to bring entry-level workers in and really give them full careers, bring them through the various levels of the nursing professions, engage kids in schools in being interested in health careers. Do you see anything going on in Congress right now that would support that kind of work?
Yes, and one aspect of healthcare that's often overlooked is home care.
Yeah.
As far as I'm concerned, home care is healthcare, and I see the lack of home care as the missing link in the social safety net for the elderly. There are more than 800,000 people on the waiting list for Medicaid-funded home care. In 2034, there are going to be more senior citizens in the United States than children. And we have to ensure that there is a social safety net in place that will enable those senior citizens to age with dignity. It's no secret that home care workers who are disproportionately women of color, who live in places like the South Bronx, are paid poverty wages. It's almost a form of wage slavery. And these were the workers who were putting their lives at risk during the peak of the pandemic, while most people were safely sheltering in place. So the Build Back Better Act would invest about $150 billion to strengthen home care, to expand the availability of home care to senior citizens and to the disabled, and to raise the wages, the labor standards of the home care workforce, which has been taken for granted and overlooked for far too long.
Well, there's going to need to be a way for all of those home care workers to be connected to healthcare in the community. And probably the community health centers would be a terrific sort of connection for them, because they're going to need to have backup from people who can, handle the medical conditions of people at home, but also to support them in the work that they're doing. Have you thought about what the backup for the home care workers would be, and what systems would need to be in place, and how that might work with community healthcare organizations like ours?
Well, we've made sweeping investments in community health centers, particularly during the American Recovery Act. And I'm deeply grateful for the partnership of Bronx Reach. I have a longstanding relationship with Bronx Reach. It was one of the first organizations with which I met when I became a city council member.
Sure, I remember.
I partnered with Bronx Reach to,
you were the first one to bring us health bucks.
Yes.
Remember that? You were the first.
In partnership with Bronx Reach, I pioneered the use of city council dollars to distribute health bucks, so that Bronx residents not only had access to fresh food, but could actually afford them. And it's by far the most popular initiative that I ever launched as an elected official. It would not have been possible without the partnership of Bronx Reach. So that's an example of what we've done at the micro level. At the macro level, we're going to strengthen the Affordable Care Act. We're going to strengthen Medicaid and Medicare through the Build Back Better Act. I'm hopeful that we're going to pass it soon, and it's going to have a transformative impact in improving the health of the Bronx.
Well, that's great. We're very grateful that you were elected. We're very grateful that you're someone with a real history of having worked with community-based healthcare providers and really recognizing the importance of healthcare in the community, as well as the things that you said, what we now refer to as social determinants of health, all of the things that people need to really lead healthy lives. So we're happy that you were able to join us today. I know that there's a lot going on right now in Congress, and hopefully they'll give you a break so that you can get home for Thanksgiving. And we appreciate your joining us.
Well, thank you for your partnership and look forward to working with you in the future. Take care.
Thanks. You too. Have a happy holiday. You can see how lucky we are to have such incredible people representing the districts where we do our work. Our next speaker is Rebecca Siegel, who works in the Department of Social Support Services at the Institute, where she supervises the care management team for the Institute's Lower Manhattan and Brooklyn sites. We've always known that social and economic factors have a major influence on a person's health, and Ms. Siegel will discuss some of the Institute's work in this area. Rebecca?
Hello, and thank you so much to our representatives for having us here this morning. I work with our social support services team, which is made up of over 100 care navigators, case managers, and other community health workers who serve our adults, children, and families, and are really here to help address the social determinants of health so that our patients can access the care they need throughout New York State. As Representative Torres reviewed with us, these factors are closely linked to our patients' chronic medical and mental health conditions, especially in the poor communities and communities of color that we work with. And I'd like to speak a little bit about some of the issues that our patients have been facing since long before the COVID-19 pandemic. One of the top challenges that we see in our various community programs is around housing. So we know that living in a homeless shelter or even being unstably housed and facing eviction has huge implications on our patients' trips to the hospital, trips to the emergency room. It even impacts the ability just to follow a treatment plan. So for instance, something as simple as having a safe place to store food or medication if a patient is working with our team around managing a condition such as diabetes or asthma. And that's not to mention the toll that we know that the stress and anxiety can take on the mental and emotional health of our patients. The home environment has obvious impacts on our patients' health, whether that's not having access to heat or air conditioning or clean water, or living with exposure to toxins such as mold and other environmental pollutants. Our patients also face a lot of financial instability, whether that's low wages, lack of access to education, or lack of access to childcare, as well as food. So it may seem an obvious one, but the Institute is part of the growing conversation around food as medicine, with the understanding of just how fundamental access to affordable, healthy food is to the health of our patients. And finally, our patients navigate the fragmented social safety net of New York every day. Representative Torres mentioned the care for our elderly patients, and one anecdote that our team works with a lot is supporting our elderly patients with Medicare who might now need long-term care, whether that's having a home attendant support them in their home, or living in a nursing home or inpatient facility, and who need our help actually getting rid of some of the assets that they have just so that they can qualify for the services that they need under the threshold for Medicaid. Our social support programs are here to patch these holes. We offer one-on-one person-centered support that includes coordinating care, empowering our patients and connecting them to the community resources that they need, and offering some population-specific partnering and counseling, whether that's for our patients with diabetes, our patients who are pregnant, just to name a few. We have the ability to meet with our patients in the clinic, in their homes, and now over video and phone to really help meet their needs in the setting where they feel the most comfortable. And again, to problem solve around some of these barriers. There might be around affordable and accessible transportation or childcare. We're embedded within the medical and mental health services as part of the FQHC model. We really believe in the team approach, understanding that that group support is necessary to address these barriers when sometimes the biggest barrier is navigating a complex healthcare system. How can our representatives continue to help support this work? The sustained funding for federally qualified health centers is essential so that we can offer these personalized supports for our patients. So much of what our team does, even in our Medicaid and insurance funded programs, is not reimbursable. whether that's providing quality training and supervision or community building and sharing resources. We're also finding that we're spending more and more of the time we have just making sure that the patients we work with fit the eligibility criteria that comes down to us through the various programs we're a part of. So the continued support for community health centers really makes this work possible. And as our representatives continue to try to tackle the root causes of the social determinants of health, our team would urge you to keep the health equity lens in mind. So we know that the closer we get to affordable housing, to quality education and jobs, to public transportation and a stronger financial safety net, the healthier our communities will be. Thank you so much.
Wow, thanks so much, Rebecca. I mean, it's amazing to me because we, not that many years ago, thought about health centers as a place where people get medical care and behavioral health care and dental care. And the expansion of our efforts now have just been practically infinite in understanding that we can't get people in our communities healthy if we're not in a position to also address some of these social and economic determinants of health. And so we're so lucky to have Rebecca, a staff of over 100 people working just to help people through all of those other issues in their lives, and hopefully to get them to a healthier place. You know, from the start of the Institute in 1985, educating the next generation of healthcare providers has been a major focus of our efforts. You're next going to hear from three people who've been critical to that effort. As educational efforts at the Institute, our educational efforts at the Institute have been led since 1987 by Dr. Red Schiller, our Senior VP for Academic Affairs and Chair of Family Medicine at Mount Sinai Beth Israel, since he started that department nearly 30 years ago. Dr. Schiller also serves as Vice Chair of the Department of Family Medicine and Community Health at the Icahn School of Medicine at Mount Sinai. After him, we'll hear from the work of our nurses, from Ms. Cindy Lou Killikelly, the Institute's Vice President for Nursing. Ms. Killikelly joined the Institute in 2011 as a registered nurse. She then served as a nurse manager at two of our Institute sites for 6 years before becoming our Vice President for Nursing and a member of the Institute's executive management team. And finally, we'll hear in that segment from Dr. Tony Mckenzie. Dr. Mckenzie is a native of Jamaica who grew up in East Flatbush, Brooklyn. She completed her medical studies at Stony Brook University School of Medicine. Before medical school, Dr. Mckenzie spent 2 years teaching high school students in the neighborhood where she grew up. Her passion for education throughout medical school allowed her to better understand advocacy and policy development. She now serves as co-chief resident in the Institute's Harlem Family Medicine Residency, a program funded by the Teaching Health Center Graduate Medical Education Program from HRSA. That program, sponsored by the Health Resources and Services Administration, is to support primary care training in community health centers across the country. So I'll turn it over to you, Red.
Thank you, Neil. And thank you to our members of Congress and their staff for all the work that you do. I'm a family physician, and I'm responsible for all the training programs at the Institute. And I'm fortunate to have been at the Institute since 1987 and can honestly state I have lived my dream job as a physician and an educator. And Dr. Gale is a proud example of the work we've done. Eric, you've done an incredible job. We are so proud of you. The Institute is unique in that we are a network of FQHCs providing essential services, and yet we are equally committed to training the next generation of healthcare workers. We believe that community health centers are the ideal classroom to teach about social, political, and economic determinants of health. Our learners experience daily the powerful impact that poverty, racism, unemployment, food deserts, as an example, have on patients' health and their communities. We actively recruit students that reflect the communities that we serve, specifically from historically Black schools and colleges. And we view our patients and their communities as teachers and faculty in a shared effort to train our learners in how to positively implement change. As the healthcare system tries to reduce preventable ER visits and hospitalization and shift resources to community programs, healthcare trainees need to spend more time in the community developing the skills they need to use the resources of FQHC's community-based organization to improve a community's well-being. Our trainees learn how to work with a multidisciplinary team based in a community setting with certified diabetic educators, social workers, case managers, care navigators, as Rebecca just indicated. And our students learn how to advocate and how to collaborate to get the services that are crucial to improving health outcomes and promoting health equity. We run 3 family medicine residencies, 2 in Manhattan, 1 in the Mid-Hudson region. And 2 of these programs are supported by the HRSA Teaching Health Center GME program. We operate a nurse practitioner residency, also supported by HRSA funding. We have an accredited addiction medicine fellowship, a women's health fellowship, integrative medicine fellowship, clinical research fellowship. One of our sites has a dental residency, and we train social workers and nursing students. Prior to the pandemic, we trained over 300 learners in 1 year. The Institute has graduated over 400 family physicians from our 3 programs, with almost 40% working in community health centers around the country. The Institute's growth allows us to hire our own graduates who can build on their training to support our mission, and some learners end up in other parts of the country carrying on the same work. I want to thank members of Congress and their staff for the support of innovative training programs like the Teaching Health Center and the Nurse Practitioner Residency Program, and we look forward to working with Congress to develop similar creative programs and training, expanding Teaching Health Center, and training other clinicians to meet the enormous gaps in our healthcare system.
Thanks,
Thank
Red.
you.
We're gonna introduce. We're gonna wait on Cindy Lou and Tony for a minute and introduce Representative Carolyn Maloney, who's on with us live. Thank you, Representative Maloney. Representative Maloney is a longstanding member of Congress. She was first elected to serve New York's 12th Congressional District in 1992, covering parts of Manhattan, Queens, and Brooklyn. She's currently chairwoman of the House Committee on Oversight and Reform and former chair of the Joint Economic Committee, the first woman to hold both of these positions. Representative Maloney is a strong supporter of community health centers and helped secure the capital funding through the American Rescue Plan. In addition, she's a champion on issues of healthcare, women's rights, and has authored legislation to help those suffering from health ailments associated with 9/11. It's really an honor to have you with us today, Congresswoman. Welcome. I don't see Representative Maloney. Said we're unmuting the wrong person. Autumn?
Hi, Representative.
There we go.
Oh. I'm not sure what's going on. I've asked to unmute and start video, but it's not working.
It's not, she's on live.
Maybe she's trying to rejoin. Sorry, everybody, a little bit of a technical glitch.
We saw her for a moment.
Oh, she's back.
Yeah, I just did.
Oh, we can hear
There we
you.
go.
Hold on, this is her staffer.
Hi, Becca. Yeah, we see you. Well, we hear you.
There should be Congresswoman Maloney should have her own little box. I don't believe she's on as a panelist. I think you have me instead. I'm sorry.
Okay, give me one moment.
I'm in DC, she's in New York. Ah, there we go. Congresswoman Maloney, I see her now.
Thank you. Thank you.
Oh, thank you. So sorry for the technical glitch.
Right.
Welcome. We're so happy to have you. Thank you.
So delighted to be here. And thank you so much for convening this event on healthcare access and for all the incredible work you do to provide healthcare to medically underserved community across New York State. Healthcare is and always should be a human right. No matter your income bracket, race, gender, or sexuality, every person deserves access to good, quality, affordable healthcare. That is why I have been a co-sponsor of Medicare for All in every Congress since it was first introduced in 2003. I also was a proud supporter of the Affordable Care Act, which was signed into law in 2010. This landmark piece of legislation has improved the coverage, affordability, and quality of healthcare for millions of people across the nation. In fact, research has shown that under the Affordable Care Act, New York State cut its uninsured rate by more than half. In addition, thanks to federal funding provided by the Affordable Care Act, the floating hospital was able to open a community health center on New York City Housing Authority property, which is in Queensbridge, Queens, the largest public housing development in America. But even with the success of the Affordable Care Act, there is always more work to be done to improve access to health care. This could not have been clearer than during the coronavirus pandemic. Millions of workers lost their jobs and their access to employer-sponsored health insurance, leaving some to choose between paying for health insurance and putting food on the table. In March of this year, Congress passed the American Rescue Plan, which helped to lower healthcare costs for those that purchase their insurance through the Affordable Care Act exchanges. This saved people across the country thousands of dollars in healthcare savings. In my district specifically, a recent report found that the American Rescue Plan could save families with marketplace health plans $6,900 a year. The American Rescue Plan also contained more than $6 million in funding for community health centers in New York, including almost $1.8 million for the Institute for Family Health. Community health centers like yours are a vital part of our city's health infrastructure, providing access to medically underserved communities and those who have historically had limited access to care. I was proud to be among a group of members of Congress that pushed for funding for community health centers to be included in the American Rescue Plan. And I hope these funds have been able to support your organization as you work to provide vital services to New Yorkers across our state. Providing access to health insurance and increasing funding for community health centers are not the only ways I have worked for their drugs under ways I have worked to improve the health of my constituents. Over the last year and a half, I have also successfully fought for COVID-19 vaccination clinics to be located in my district in areas such as Roosevelt Island, St. Nick's Alliance, Cooper Park houses, the Lower East Side, and other sites. I am also currently working to bring a mobile COVID-19 vaccination and testing center and community health center to Astoria houses, because without access to COVID-19 vaccines and tests, we cannot fight this deadly pandemic. And Astoria houses is one of the most underserved areas in our city. In addition, just last week, I voted to pass the Build Back Better Act, which contains provisions to make prescription drugs more affordable and gives Medicare the ability to negotiate lower drug prices for seniors. This is something I have prioritized in my role as chair of the House Oversight and Reform Committee and will continue to work towards. Under the Build Back Better Act, seniors will pay no more than $2,000 per year out of pocket for their drugs under Medicare. The bill will also ensure Americans with diabetes won't pay more than $35 per month for their insulin. And at my urging, the Build Back Better Act also provides $2.86 billion to the World Trade Center Health Program, which provides medical treatment and monitoring for more than 110,000 responders and survivors across the country, 2,800 of whom live in my district. Rest assured that I will do all that I can to fight for access to quality health care. This includes working to bring a community health center to every single housing development in my district. Because until everyone has access to health insurance, we are not equal. I want to thank you so much to the Institute for Family Health for everything that you have done to provide affordable and available health care in New York City. Thank you. And I yield back. Thank you.
Yeah, and thank you so much. You know, we would never have survived the pandemic as a network of community health centers if it wasn't for the rescue funds that were sent to health centers at the peak of the pandemic that allowed us to convert to telehealth and to do all the things that we've been able to do, and also to keep the majority of our employees employed through that. It really was a lifesaver. And so we thank you. You've been a staunch supporter of the health centers for many, many, many years. And we're incredibly grateful to you. And thank you for joining us today in person.
I want to thank you, Dr. Neil Kalman, for what you do, because I really believe in the community health centers. I think they're one of the best vehicles that we have to really reaching people. And it's through the community health centers that the underserved communities are reached. And it needs special attention. And you have given that. And you've saved lives. Bottom line, improved healthcare. I thank you very much. I want to continue working with you to move more community health centers across New York City, really across America.
Well, thank you. We look forward to that. Back to you, Red.
Thank you, Neil. It's my honor to introduce Dr. Tony Mckenzie, our Chief Resident in Family Medicine at our Harlem-based program. Our healthcare system needs physicians like Dr. Mckenzie, who will lead us to improve our ailing healthcare system in implementing positive change. Dr. Mckenzie is joining us for a brief moment from her responsibilities in the hospital. Thank you, Tony, for joining us. We're so proud of you.
Hi, everyone. Thanks for having us. My name is Tony Mckenzie. I'm a chief resident at the Harlem Family Medicine Residency at the Institute for Family Health, known to us as IFH. I joined the program in 2019. Thanks to THC funding, I was able to become a trainee at my first choice residency program. Since being here, not only have I reaped the benefits of training in a high quality program, but also my patients have reaped the benefits of high quality practice. To this day, I'm grateful to have matched to my number one choice program. As a Jamaican immigrant who grew up in Central Brooklyn, I am acutely aware of the primary care deficiencies in an urban area. At IFH, I have the opportunity on a daily basis to tackle these deficiencies and inequities. One, at our health center, I am well trained in procedures ranging from dermatologic skin conditions to endometrial biopsies to screen for uterine cancers. Patients no longer have to wait for referrals and appointments to see specialists to have these procedures done. Two, because my training is linked at Mount Sinai Hospital, I can quickly have patients see specialists if they need to, while simultaneously receiving training from these same specialists on acute healthcare management. This highlights the benefits of an affiliation with a hospital recently ranked #1 in New York City for specialty care. Here's an example. While on my emergency medicine rotation, I admitted a patient who had severe lupus that affected her kidneys. The patient was followed by our team for primary care, by rheumatology, and by nephrology. During her hospital stay and afterwards, I have been in close contact with both departments regarding the patient's care and also have been given feedback and learning pearls from these specialists on how to manage patients with lupus. With such broad training, IFH ensures that its graduates will be able to practice in many settings, in the clinic, in the hospital, or in urgent care. 3, training here, I'm learning how to advocate for patients on many levels, from writing letters to NYCHA, advocating for a patient living with multiple sclerosis to have his apartment moved to the first floor because he can't climb the steps, to speaking with folks like yourself, congressional members, to ensure the maintenance of the care that I provide. Here at IFH, I'm being trained to be a leader and a change maker. 4, I have the privilege of training under some of the best primary care doctors in the city. Doctors who have graduated from this program, doctors who are knowledgeable on the social determinants of health and ensure that my training keeps that in focus. And doctors who are dedicated to my growth as both a professional and as a leader. In all, THC funding has helped me become a well-rounded physician leader in an underserved urban setting. And continued funding will ensure this opportunity to many other aspiring physician leaders. Thank you all for your time and for having us.
Thank you, Dr. Mckenzie. Wow, it's really an inspiration to see the next generations of family doctors being trained in our organization and going on to carry on the work that we've been doing for so long. Now, Cindy Lou, thank you.
Good morning, Representative Maloney. Good morning, everyone. Thank you for this opportunity to speak on the impact and importance of the nursing workforce to providing care to our primary care patients. Nurses are vital to our work as a community health center. Currently, we are experiencing a significant shortage of nursing staff, more specifically, registered nurses and licensed practical nurses. We currently have a 30% vacancy rate. In New York, there will be a projected shortage of 39,000 RNs by 2030 and a limited availability of slots in nursing schools. This shortage has a tremendous impact on the quality of care we can provide to our patients. During the pandemic, many of our patients have postponed getting routine care for some time. When they do come to the health centers, they need to be caught up on preventive care like immunizations and screenings. In addition, often their chronic conditions like their diabetes and hypertension are uncontrolled. Nurses, along with our providers, work with patients while they are at the health center to receive quality healthcare and encourage preventive care through patient education to help them stay healthy. As Dr. Gale shared earlier, the nurses at the Institute have been instrumental in administering more than 30,000 COVID vaccines. Under the present conditions, with such severe staffing shortages, spending time with patients, doing motivational interviewing to develop their trust is challenged. The more time spent helps improve the nurse-patient relationship. Additionally, due to these shortages, it limits our hours of operation to provide increased evening and weekend hours, which impacts our patient access to care for some of our most vulnerable patients. Nursing is a wonderful career opportunity for many. Because there is such a well-defined career path, starting as a medical assistant with continued growth to grow through training and experience. Many young people start out in entry-level positions and become nurse managers over the course of their careers. And they work in a variety of settings, from primary care offices to nursing homes and hospitals. Supporting nursing training and making it more accessible is a great investment. We are grateful that the Title VIII Nursing Workforce Reauthorization Act, which was included in the Coronavirus Aid, Relief, and Economic Security Act, the CARES Act, is now signed into law. We hope that provisions will be made to increase the nursing workforce by providing scholarships to nurses and increasing training programs in both rural communities and in the underserved urban communities, where many of our health centers operate. We appreciate your interest in this issue and look forward to continuing discussions with you to help address this critical need. Thank you.
Thanks so much, Cindy Lou. Oh boy, you know, the staffing issue has really come, everybody's been watching the news, but not just in healthcare, but especially in healthcare, staffing has become a critical issue. So we're very aware of that, and we are working diligently to fill the many vacancies we have in staffing right now, and the vacancies that are had across the whole healthcare sector, from hospitals, home care, as you heard before, everywhere in healthcare. I'm now going to introduce Dr. Marta Sanchez. She currently serves as Associate Medical Director at the Institute's Kingston Family Health Center. She completed her medical degree at the Universidad Autónoma de Guadalajara before coming to the Institute for her residency in family medicine at our Mid-Hudson Family Medicine program, where she is now a faculty member. Dr. Sanchez will be moving to our newest site in Kingston when it's completed in late 2022, and will serve there as the site's medical director. Dr. Sanchez, welcome.
Thank you. Thank you for this opportunity to speak today. I am Dr. Marta Sanchez, the Associate Medical Director of the Institute for Family Health of the Kingston office. I just want to reinforce what was mentioned of the importance of the teaching health center programs, which have been so critical to training new doctors to serve rural communities. We have been fortunate to have benefited from the opportunity to train residents in our health centers, which has provided significant number of doctors in our communities. For instance, like just mentioned, I am one of those doctors who trained here as a student, a resident, and now teaching faculty. I have been here in the Mid-Hudson area now for the last 11 years. My main purpose today is to talk about the importance of access to primary care in rural areas. I first want to say that primary care is a human right to every individual, not just to those with access or the means. It's about educating our patients on preventing diseases and maintenance for chronic conditions. As community health centers and as family physicians, we do provide medical care to our communities, and we treat our patients as a whole. Access to clinics in rural areas can be a challenge for a vast majority of our patients. Clinics are not walking distances. For some, it's very different than a major metropolitan area in which transportation and clinics are easily accessible. Our patients tend to walk long distances, sometimes take cabs, buses, bikes, and rely on friends or family or neighbors for transportation. Lots of appointments are missed or not being scheduled due to transportation or access difficulties. Which is why telehealth plays such an important role. At the start of the COVID-19 pandemic, the Institute developed the capacity for telehealth at warp speed. Both clinicians and patients alike benefited from this. There was not a day that our patients lacked of care. This helped those with both acute, chronic illnesses and gave a chance to speak to a provider and receive care. It also addressed limitations due to transportation issues and assisted those who have no time for medical care due to work, inability to make an office appointment. We provided care to our patients in a manner that decreased unnecessary emergency room visits. This is not a complex option for care and should remain permanent. One problem we did encounter in our upstate community, however, is that not everyone can access video. And while we like seeing our patients via video, sometimes it's not possible due to the absence of internet service, appropriate devices, technical capacity, as some of our elderly population lack, even though not all of them. In these cases, it is important that we provide medical care over the telephone. I'd like to give an example of a telephone scenario in the height of the pandemic. I had the wife of a patient call, hysterically concerned for her husband. I asked to speak to him as they lacked the capacity for a video telehealth. I did not need a video to know he was short of breath and needed prompt medical care. My staff and I quickly called EMS. We notified the hospital, and the patient was admitted that night. Unfortunately, there is a tremendous gap in payment for video versus telephone visits. This needs to be changed as both are valuable. Video is a luxury, not all access, especially in rural areas. Although we may not be able to see the patient physically, we are in no way providing lesser care. Improving broadband and internet speeds in our communities is definitely crucial, but we are succeeding with the tools we currently have at hand. And that's pretty much all I have today. And I just want to thank the Congress members for being such strong allies for both primary care and teaching health center funding, along with other representatives who share the concerns. Thank you.
Thank you. Thank you so much, Dr. Sanchez. Again, a graduate of our residency program who has stayed on with us, become faculty, now training the next generation of physicians for these communities, and soon to be running our newest site in Kingston, which is just amazing. So many of the people who work at the Institute have trained with us or have come through our centers as students. This is a multi-generational kind of exercise where we, those of us in faculty positions, those of us in leadership, have the opportunity to influence the decisions that people make by showing them the rewards of the types of practices that we do. And it really is amazing. With that, I just would like to turn to Dr. Carmen Veloz. Dr. Veloz holds a PhD from Fordham University. She is a licensed bilingual clinical psychologist. She's currently the Institute's Upper Manhattan Regional Director for Behavioral Health, a position she's held for over 3 years. She's responsible for behavioral health staff working at 5 locations, including 3 school-based health centers, a satellite center at Amsterdam Avenue in Manhattan, and 2 centers operating out of the Institute's Harlem Family Health Center. Behavioral health is a major focus of the work that the Institute for Family Health does. Welcome, Carmen, and thank you for joining us.
Thank you, Dr. Kalman, for inviting me. I'm very honored to represent behavioral health services for the Institute for Family Health. At the Institute for Family Health, we are the largest provider of behavioral health services among FQHCs in New York State. In the role, as you mentioned, as Upper Manhattan Regional Director, I oversee staff in 5 locations and am responsible for overseeing the day-to-day operations, as well as training and supervision and a whole other host of duties. As a Dominican immigrant and now bilingual clinical psychologist raised in Washington Heights, I am keenly aware of the cultural stigma associated with participating in behavioral health services and the barriers to accessing quality behavioral health care in our communities. As mentioned by some of my colleagues, the COVID-19 pandemic served to highlight health disparities, but also brought about an overwhelming demand for services from patients experiencing an inordinate amount of psychosocial stressors, such as increased substance use, loss of loved ones, loss of income, loss of housing, food insecurities, inability to access education, and many other services and necessities. Fortunately, at IFH, we were able to transition behavioral health services to telehealth in a matter of 24 hours after the sheltering in place order took effect, providing us the ability to continue care to our existing patients and begin care for as many new patients as could engage in telehealth services. One of the areas of service excellence has been our attention to substance use and abuse issues in our communities. We continue to see patients with co-occurring mental and substance use disorders, which negatively impact overall health outcomes. At IFH, we practice an integrated model of care where primary care physicians work side by side with behavioral health practitioners to ensure that there is continuous assessment of substance use and other disorders and immediate connection to services. Behavioral health services such as therapy, psychiatric services, and other interventions, including medication-assisted treatment and Narcan distribution, are some of the ways we are doing all we can to address the opioid epidemic, which continues to plague Harlem and many other communities where our centers are located. Our increase in demand and services did come with some fallout. As noted with other healthcare professions, we lost many staff members to burnout, relocation, and some even changed their career paths. As a result, we continue to experience workforce challenges and need support from legislators to continue to build our programs. In order to continue to meet the demands for behavioral health care, we wish to partner with you in efforts to pass legislation that will reimburse telehealth services at the same rates as in-person services. This will enable us to recruit and retain staff with competitive salaries in this nonprofit environment. Again, I thank you for this opportunity to share about the work we do, and we appreciate all of your support.
Thank you, Dr. Veloz. And we're so excited that you have such an important leadership position. And I know that you share some of the same roots with Representative Espana, who I see has now joined us. And I just want to introduce him. Representative Adriano Espana represents New York's 13th Congressional District, which covers Harlem, Washington Heights, and parts of the Bronx. His committee assignments include the Key Committee on Appropriations, its Subcommittee on Housing and Urban Development, and the Committee on Education and Labor, and the Subcommittee on Workforce Investment, which we just talked about. Representative Espana is a member of the Congressional Hispanic Caucus, the first Dominican American to serve in the U.S. House of Representatives. He's been a strong supporter of federally qualified health centers, having visited our Harlem Center, I think twice now, recently helping to fund $8 million for health centers in the district and for improving the mental health of his constituents. It's truly a pleasure to have you with us, Congressman. Thank you so much for joining us.
Thank you so much, and good afternoon, everyone. I would like to thank Dr. Carmen and all of the hardworking frontline health professionals for inviting me to speak to you today. As it has been already stated, the COVID-19 pandemic has exacerbated America's mental health and substance abuse crisis in so like unimaginable ways. It has exposed an unmet need for access to behavioral health treatment that has existed long before the pandemic. Isolation, concerns about personal health and financial threats, and the loss of loved ones without appropriately saying goodbye to them have created a perfect storm of unprecedented levels of psychological distress. In fact, according to the Census Bureau, more than 42% of people reported symptoms of anxiety or depression, an increase of 11% from the previous year. And here in New York, 1/3 of New Yorkers are reporting to have high anxiety disorders. So this is really a crisis, I say a national crisis. And seeing this developing crisis, my Democratic colleagues and I fought to include $425 million for substance abuse and mental health services in the CARES Act, which became law back in March of 2020. The funding was critical, right? It was in preserving and ramping up services provided by certified community behavioral health clinics, suicide prevention programs, and emergency response targeted support also has been provided. However, there's much more to do. And we see the detrimental efforts and effects of COVID in rapidly increasing numbers of drug overdoses. Last week, CDC reported that drug overdose deaths reached an all-time high, with more than 100,000 Americans dying. That's a staggering number, and it's something that we must continue to address in dramatic ways. It is clear that people are in need of assistance, but many also feel that there are barriers of accessibility for that help. So we must work on that as well. Unfortunately, existing prevalent racial and ethnic disparities have meant that people in Black and Brown communities, like the ones that I represent, are less likely to seek or receive mental health care in their corners or in their communities. And so this is a major problem. Last week, I was proud to vote for the Build Back Better Act, which includes $75 million towards expanding diversity in the mental health and substance abuse disorder workforce. It would also include $75 million that will expand the suicide prevention lifeline. And this is so critical post-pandemic. I'm also glad that Governor Hochul has clearly made investments in mental health services and workforce priority. So we must continue to work with this. Our district is one that any neighborhood that you walk in, you see it right there in many corners of our neighborhoods, impacting businesses and the quality of life in communities. And so we must help folks that are being dramatically affected by this. And we must address this mental health and substance abuse tsunami impacting the nation, but particularly disproportionately impacting my district. Thank you so much.
Yeah, I hope you could stay on for a question or two. You know, one thing that's really been remarkable through the last few years, and especially through the period of COVID, was the extent to which people started to request and need mental health services. It's really been mind-boggling. We've always been impressed by that. Two things have sort of, I would just point out. One is that by integrating behavioral health into primary care, people can come to a primary care center without the same stigma oftentimes that people have when they're going just for mental health services. And the second thing is telehealth has sort of helped in that regard too, where people in a very private sort of setting, can get on their computers and speak to a therapist without really even having to come to a center. And I think both of those things have really increased the demand for behavioral health services.
Well, certainly telehealth proved to be critical and life-saving during the pandemic, and continues to be an important model to follow as we move forward. And we're seeing the numbers. I saw the numbers this morning, not encouraging. This continues, unfortunately, and so telehealth, as well as other models that were developed during the pandemic that proved to be so critical, we'll have to continue to rely on, and we'll have to continue to fund. And I really want to thank the healthcare workers that are in this call and are associated with these efforts. Without them, I don't know where we will be right now. So that their work is appreciated, their work is valued, and we are forever grateful for the kind of role they played during this pandemic and continue to play as we move forward.
And I want to thank you also for your incredible support of community health centers, of behavioral health. And not many people have jumped up to support the need for behavioral health as you have. And it's been tremendously valuable to those of us who provide those services to have your support. We were very fortunate that the New York State Office of Mental Health jumped in quickly and guaranteed the same reimbursement for telehealth as we were getting for in-person health. That was an incredibly important thing. And they literally were revolutionary in doing that. It took quite a while afterwards for the health department to do the same thing with the physical health. And I think having your support has been very important in getting the recognition for behavioral health that it deserves. I also want to thank your staff because they have been instrumental in helping us to put this program together.
Yes,
when we
they
first
have.
approached you and you agreed to sponsor this and to be our guardian for putting this together. We were hoping to do it in person, but not quite yet, but hopefully soon we'll be in Washington and be able to have our third congressional meeting in Washington. So thank you so much for your continued
Thank you, and I
support.
look forward to that day and having you back in Washington again. But for now, I want to thank you again for all the work that you do for my constituency. Thank you so much.
Thanks
Take
for
care.
joining us today.
Bye-bye.
So we're going to have a few minutes at the end for some Q&A. If you want to put some questions in the chat, we will definitely try to reach those. And if not, we'll answer them through email. But I want to introduce as our last event, basically a recording that was done by Congressman Antonio Delgado, who represents New York's 19th congressional district, which spans a large section of the Mid-Hudson Valley. Congressman Delgado attended Harvard Law School, was a Rhodes Scholar. He's chairman of the House Agricultural Committee on Commodity Exchanges, Energy, and Credit. The congressman serves on the House Small Business and Transportation and Infrastructure Committees. His work in Congress has included making healthcare more affordable for Americans, as well as expanding rural broadband, which has been a big issue of his. And that will definitely improve access for many of his constituents, especially as we're using communications through computers to do so much more for people with healthcare. So we have a recording from Congressman Delgado, and then we'll open up for Q&A.
Hello, everyone. It is good to be a part of your virtual meeting on primary care. I do want to say thank you to Dr. Coleman for extending the invitation. For those who don't know, I am Congressman Antonio Delgado, and I am proud to serve New York's 19th Congressional District, home to 5 family health locations, from Kingston to Ellenville to Hyde Park, New Paltz, and Port Ewing. I have to say I've been to a few of the locations, and every time I have been there, I have been deeply impressed with the commitment and the care to service. We need so much of that now more than ever. I want to start off by saying thank you. Thank you for your tireless efforts. Thank you for leading with love. Thank you for your compassion. Thank you for your service. What we've been able to endure over the last year and a half now has been nothing short of incredibly challenging. And I can't even imagine what those of you on the front lines have been asked to go through and manage, what you have seen, what you have witnessed, and how you have sustained yourselves. So let me just say thank you from the bottom of my heart. I want to be clear, though. Saying thank you is not enough. We need to make sure that you have all the support, all of the resources that you deserve in order to do the job that you all do to the best of your abilities. And that means stepping up across the board and making sure that whether it's the CDC, whether it's the National Institutes of Health, whether it's the Substance Abuse and Mental Health Services Administration, we do everything at our disposal at the federal level to support you with those resources. And we've been doing that, particularly with an emphasis on rural communities, as I serve a district that is the 8th most rural congressional seat in the entire country. I also am proud to support bills like the Better Care, Better Jobs Act, transformative investment in our home and community-based care efforts, both on the side of those who are being cared for, as well as for our caretakers. So making sure that we double down on those efforts legislatively. Broadband is also something that I think we all can appreciate, again, in our rural communities is so critical, particularly when it pertains to telehealth. I think we've got to make sure that in the 21st century, those individuals in our rural communities and our seniors in particular, but also those who utilize telehealth for mental health services is something that we have to be able to step up and make sure everybody has access to. I'm proud to say that we were finally able to get the bipartisan infrastructure bill through the House, and now it's on its way to the president's desk. There's billions and billions of dollars in that bill for broadband. So looking forward to seeing those investments be put into work and making sure that we're able to provide the infrastructure that we know our communities need via broadband to be cared for. Let me just conclude by saying, again, thank you for all of your work. Thank you for your dedication and your commitment. It has been a very challenging time, but all of you have met the moment. Please know that I will continue to support organizations like yours, do all I can to be there for you. Understand that I am an ally and that I am with you every step of the way. Please stay safe, stay healthy, and God bless.
Wow, what a great message to end with. This concludes our program for today. I want to say some special thanks to Jackie Chiafalo, to Rick Blake, our Washington representative, to Autumn Henry, Maxine Golub for their help in organizing this webinar, and to the congressional staff who've made sure that their folks were available, both for recordings and to be in person. I welcome anyone interested in learning more about the Institute for Family Health to go to our website, which is easy to remember, www.institute.org, or to email me directly at ncalman, C-A-L-M-A-N, @institute.org. If you have any questions, please feel free to email us. And I thank you for your attention. I wish you all a very happy Thanksgiving holiday, and thank you for spending some of your precious time with us. Have a good rest of the day.